This video is intended to be a resource for women who just learned that a concern was identified by her NIPT result. So your OB provider just notified you that your cell-free DNA non-invasive prenatal test, NIPT, such as Harmony, InformaSeq, Verify, Maternity 21, or Panorama, came back as high risk or screen positive or aneuploidy detected for one of the trisomies, such as Down syndrome, trisomy 18, trisomy 13, trisomy X, Turner syndrome, or Klinefelter syndrome. You may be asking yourself, what does this mean? And now what? It is important to remember that NIPT is a screening test, though an effective one, and is not able to tell anyone for sure if her pregnancy is affected with any of the conditions for which it screens. This blood test measures fragments of genetic material of the mother and baby through the mother's blood. It's intended to identify pregnancies that have a significantly increased chance to be affected by one of these conditions. However, these results can be falsely positive, which means a pregnancy identified to have an increased chance to be affected with Down syndrome can later be confirmed not to have Down syndrome. When an increased chance is identified, diagnostic testing, such as amniocentesis and level 2 ultrasound, will be offered. Even if a woman declines diagnostic testing, she may still prefer to have this information to prepare for the now higher possibility her pregnancy is affected with Down syndrome, and wait until delivery for further testing to be performed for the baby. The chances that a positive result is a false positive depends on the type of testing performed. This table indicates the different genetic conditions across the top row and different types of NIPT down the left column. For each test type and genetic condition, how effective the testing is can be found in black, and for that test type, how often the test wrongly identifies a pregnancy at risk is listed in purple. As of December 2014, InformaSeq is the NIPT performed by LabCorp, which is used by most military clinics. The chance of a false positive with InformaSeq is written in red. The false positive rate for Down syndrome through InformaSeq is 0.2%, or 1 in 500. That means of 500 pregnancies the testing identified as having an increased chance to have Down syndrome, one of those pregnancies was later confirmed not to be affected with Down syndrome. The other 99% were confirmed to have Down syndrome. It's important to note that these chances are for general testing, not specific to any individual. Most test results do not provide specific chances of the condition for a particular patient. You will be referred to the maternal fetal medicine clinic to have a level 2 ultrasound at about 18 weeks in pregnancy. That ultrasound will take about 30 minutes to complete and will look at the baby by ultrasound to identify if there are any concerns with growth or other physical changes in development that are important to know prior to delivery, or that indicates the baby may have physical or intellectual disabilities. If you're very early in pregnancy, you may request to be seen for an earlier ultrasound to confirm a miscarriage has not occurred, or to look for some obvious changes in development that can be seen earlier, such as a cystic hygroma, which is a swelling of fluid, usually behind the baby's neck. For some conditions identified by NIPT, anomalies or concerns are not expected to be seen by ultrasound, such as for trisomy X, Klinefelter syndrome, or Jacob syndrome. Several of the other conditions have characteristics that are not always seen by ultrasound, but are often present, which helps provide more information about the health of the pregnancy and can help in making a decision about further testing like amniocentesis. In babies with Down syndrome, about half will have a change in the structural development of the heart that may require surgery after birth. There may also be a narrowing or blockage of the beginning of the small bowel, called the duodenum. Other findings may include a cystic hygroma, skin thickening behind the neck, shorter arm or leg bones, enlarged area of the kidneys, bright bowel, bright spots in the heart, absent or underdeveloped nasal bone, or a small amount of fluid in the brain called ventriculomegaly. It is also predicted that at least 20% of pregnancies affected with Down syndrome will not show any concerns by ultrasound. Ultrasound findings of babies with trisomy 18 and 13 are often less subtle. Babies with trisomy 18 can show heart problems, spina bifida, an omphalocele, which is when parts of the baby's organs can push into the umbilical cord, kidney problems, cystic hygroma, clenched hands or wrists, rocker bottom or club feet, small growth, cysts in the brain, 2-vessel umbilical cord instead of 3, and excessive amniotic fluid called polyhydramnios. Babies with trisomy 13 can also show heart problems, changes in brain development, cleft lip or palate, kidney problems, extra fingers or toes, rocker bottom feet, cystic hygroma, small growth, and 2-vessel cord. The most common findings for Turner syndrome include cystic hygroma, heart problems, kidney problems, skin thickening, or extra fluid behind the baby's neck. Further testing can be performed in pregnancy that can produce a full picture of all of the baby's chromosomes for multiple cells. By doing this, it is able to diagnose with 99.9% accuracy when a baby has Down syndrome or other conditions screened by NIPT. 2 different procedures are available to obtain cells to perform diagnostic testing. Chorionic villus sampling, or CVS, can be performed from about 10 to 13 weeks in pregnancy. Amniocentesis can be performed from about 16 to 24 weeks in pregnancy. Both procedures involve going through the amniotic sac to get samples of cells from the pregnancy. Therefore, both have small chances of miscarriage, less than 0.5% chance, which is about 1 in 300 to 1 in 500 women having one of these tests. Any woman with a positive NIPT result should expect to be offered a level 2 detailed ultrasound at about 18 weeks in pregnancy. Diagnostic testing will be offered, and you must decide if you wish to have testing like amniocentesis performed during pregnancy, or if you wish to wait until after the baby is born to have any further genetic testing. Things to consider in making your decision include thinking about how anxious you may be to know for sure if the baby will have a genetic condition, or if it would change what you'll do in the pregnancy, such as consider pregnancy termination or placing a baby with special needs for adoption, or if it would be helpful to know the information to plan for childcare or other similar planning. Some families who learn during the pregnancy that the baby is not expected to survive the pregnancy or live long afterward may approach the remainder of the pregnancy differently to make special memories when time is limited. If you wish to learn more about the specific genetic conditions in making your decision about further testing during pregnancy, you may speak directly to a genetic counselor or visit any of these websites to get additional information. There's also a separate video that talks about inheritance and more details about the genetic conditions. Links for these sites are also listed at the bottom right of the prenatal genetic testing page on the Walter Reed website. To schedule your appointment for Level 2 ultrasound at Walter Reed, please call 301-319-5050 and allow about 3 days after your provider has entered your referral to be able to make that appointment.